Your liver has already lost function you'll never get back. And there's a real chance it happened without a single day of pain to warn you. That's the terrifying part doctors rarely explain clearly enough. This organ can be quietly failing for years while every blood test still comes back looking almost normal, while you still feel fine enough to ignore the small things. By the time real pain shows up, the liver has usually already absorbed the worst of the damage. So the real question isn't whether you'll feel sick, it's whether you'll notice the signs your body is already giving you right now before pain ever becomes part of the story. Liver disease used to be framed as someone else's problem, a consequence of heavy drinking, nothing more. That framing is outdated and dangerous. Ultra-processed foods, loaded with refined sugar, the overuse of certain seed oils, painkillers taken more often than intended, and viral infections like hepatitis B and C are quietly damaging livers in people who've never had a drink in their life. The liver absorbs this damage first and reveals it last. That gap between damage and symptom is exactly why so many cases are only discovered after real, sometimes irreversible scarring has already begun. What makes this organ different from almost every other part of your body is its stubborn silence. Your heart gives you chest tightness, your stomach gives you cramping, your liver, for the most part, gives you nothing until it starts giving you everything at once. That's why the 10 signs you're about to hear matter so much. They are the liver's only early language, spoken quietly through your eyes, your skin, your urine, and your energy, long before anything shows up on a standard checkup. The first sign hides in your vision, and almost nobody connects it to their liver. If it's become noticeably harder to see clearly at night, in dim rooms, or while driving after sunset, pay attention. Here's the actual mechanism behind it. Your liver manufactures a protein called retinol-binding protein, whose entire job is to transport vitamin A to your retina. When liver function starts declining, production of this protein drops. Vitamin A stops reaching your eyes efficiently, and night vision weakens as a direct result. This isn't a theory. Clinical research on patients with liver cirrhosis has repeatedly confirmed a measurable link between low retinol-binding protein levels and impaired night vision. If your eyes are struggling more than they used to once the sun goes down, that's not just getting older. That's a signal worth mentioning to a doctor. The second sign settles into your legs. Persistent swelling around the feet and ankles, particularly if it worsens by the end of the day, often points to falling levels of albumin, a protein your liver is responsible for producing to keep fluid properly balanced inside your blood vessels. When albumin production drops, fluid stops staying where it belongs and leaks into surrounding tissue instead. Gravity does the rest, which is exactly why the swelling tends to concentrate lowest in the body, in your feet and lower legs by evening. The third sign doesn't hurt at all, which is exactly why people ignore it. Small yellowish or pale patches forming near the eyelids, medically known as xanthelasma, appear when a struggling liver can no longer regulate cholesterol efficiently. Instead of processing it properly, the body allows cholesterol to deposit just beneath the skin, usually in the thin skin around the eyes first, because that's where it's most visible earliest. The fourth sign is something you can actually feel. A dull ache, pressure, or heaviness beneath your right rib cage, especially intensifying after eating, often traces back to changes in bile. When liver function is impaired, bile can thicken and its normal flow toward the gallbladder gets disrupted. In some cases, this creates enough pressure to radiate discomfort toward the right shoulder or upper back, confusing people into thinking it's a muscular issue when it isn't. The fifth sign shows up as bruises and bleeding that seem disproportionate to what caused them. A minor bump that leaves a lasting red or purple mark, particularly on the arms or lower legs, deserves attention. Your liver produces the clotting factors your blood relies on to seal small injuries quickly. When that production slows down, blood vessels under the skin break more easily and take longer to properly clot, leaving marks that seem far too severe for such a small impact. Here's where most people get misled by oversimplified lists online. Dry, cracking skin, particularly around the heels, is sometimes associated with poor nutrient processing when the liver is under significant strain. But this sign is far less specific than the others, and cracked heels have plenty of unrelated causes, from cold weather to unsupportive footwear to simple dehydration. It should never be treated as confirmation on its own, only as a small data point worth noticing if it appears alongside several other signs on this list. The sixth clear and reliable sign is urine that looks unusually dark, closer to tea or cola than its normal pale yellow. Your liver is responsible for filtering bilirubin out of your blood. When that filtering process slows down, bilirubin accumulates and gets expelled through urine instead of being processed normally, visibly darkening its color, sometimes within just a day or two of worsening liver function. That same buildup of bilirubin, when it becomes severe, produces the seventh and most recognizable sign of all: jaundice. This is the unmistakable yellowing of the skin and the whites of the eyes, and it remains one of the clearest indicators of liver dysfunction in all of medicine. Here's the part that should genuinely concern you. By the time jaundice becomes visible, the liver is typically already under significant measurable stress. This is precisely why the earlier, quieter signs matter so much more than people realize. Waiting for jaundice means waiting until the problem has already escalated. The eighth sign appears as small, spider-like blood vessels visible just beneath the surface of the skin, often clustering on the face, neck, or upper chest. Liver damage can disrupt the body's normal hormone regulation, allowing estrogen levels to rise higher than they should. This hormonal imbalance makes small blood vessels more visible than they'd otherwise be. And it's a pattern seen with particular frequency in people living with hepatitis or cirrhosis. The ninth sign might be the most exhausting one of all: persistent, unexplained itching, sometimes severe enough to disrupt sleep for weeks at a time. When your liver can no longer properly filter bile acids out of your bloodstream, those acids begin accumulating just beneath the surface of your skin instead of leaving the body the way they should. No lotion, however expensive, resolves this kind of itch because the source of it isn't on your skin at all. It's underneath, in your bloodstream. Now notice something important about everything you've just heard. None of these 10 signs exist in isolation for no reason. Each one traces directly back to a specific job your liver is failing to perform properly: producing essential proteins, filtering toxins and waste, balancing hormones, or regulating cholesterol. That's what separates useful medical knowledge from vague internet fear-mongering. You're not simply memorizing a checklist of scary symptoms. You're understanding the actual biological mechanism behind each one, which means you'll be able to recognize the real pattern when it appears, instead of panicking over something unrelated and harmless. So what should you actually do with everything you now know? If you recognize 2 or more of these signs appearing together, particularly jaundice, dark urine, persistent swelling, or unexplained bruising, don't wait around hoping it resolves on its own. A simple liver function test, paired with an ultrasound if your doctor recommends one, can clarify exactly what's happening inside your body within days, not months of uncertainty. Here's the part of this story that almost nobody hears, and it's the most important part of all. The liver is one of the only organs in the entire human body capable of genuinely regenerating itself. Reducing alcohol intake, cutting back on processed foods and added sugar, moderating how often you rely on painkillers, and getting properly screened for viral hepatitis can allow a damaged liver to repair itself in ways few other organs ever could, provided the damage is caught before it hardens into permanent scarring known as cirrhosis. Once that scarring sets in, the window for full recovery narrows dramatically. But before that point, the door stays open far longer than most people assume. That's the real takeaway buried underneath all 10 of these signs. Your liver doesn't fail you suddenly, without warning. the way people often imagine. It's been trying to tell you something for a while now, quietly, patiently, through your eyes struggling in the dark, through swelling in your feet by evening, through urine that's darker than it should be, through itching with no visible cause. The only real question left is whether you'll keep listening to those quiet signals starting today, or whether you'll wait until your liver has no quiet way left to warn you at all.